Dr. Athena Hall. She is a pediatrician and founder of ZNA, a network dedicated to transforming healthcare from within to a more community centered, relationship driven system. With a background in global health, she has a passion for health equity and community inclusion and sees these elements as foundational for a healthy system. Athena, please tell us about your work.
Yeah, thank you so much. Yeah, so Xena is a network to bring people together across sectors within healthcare and outside so we can shift the healthcare system on a foundational level. So, a little bit about me. I am a pediatrician. I live in Seattle, Washington. I'm in hospitals and urgent care. I went into medicine actually because I have a passion for global health work, and I felt really drawn to learning about healthcare systems. And I did a global health fellowship right after my residency training, where I saw a lot of the problems in our healthcare system with its hierarchical nature, with providers knowing the most about health and patients knowing the least. I also saw how communities weren't included in our decisions about the services that were being provided. And we were pushing a one-size-fits-all Western healthcare model on these communities. And I also saw that it was a disease management system rather than a system that is promoting health from a prevention side. And so one quick story there was a mom who had a child in the hospital. In order to pay for his treatment, she had to sell a big chunk of their land and all of their family's animals, as well as stop feeding two of her children. And it was really disturbing to me at the time. But then I also realized in the US that we have 2/3 of bankruptcy cases due to medical debt. And the sacrifices that people have to make in order to care for themselves and their loved ones is enormous in this country. We're also not listening to our communities and including them in the decisions around what services are provided to them. And we are really putting out fires in our healthcare system rather than preventing them in the first place. So coming back to the States, I felt pretty isolated and powerless to make any changes on my own. So I started building Xena so that I could bring everyone together. I know there are other passionate people out there who want to advocate for a more human-centered healthcare system. So everyone here knows that people are ready for change in healthcare. We have almost 50% of healthcare workers reporting feeling burned out, and majority of Americans report that the healthcare system is failing to meet their needs. It's very costly, the quality of care, it's really convoluted, and there's just so many issues and needs that aren't being addressed within our healthcare system. So the vision for Xena is a healthcare system that puts people and communities first. It builds strong relationships, and it cares for the whole person. Our mission is to bring healthcare workers and communities together so that we can collaborate and create meaningful change in healthcare quickly and effectively. The problems that Xena addresses is burnout and disengagement within the healthcare system. I believe that the root of burnout is a misalignment in values. A lot of people came into healthcare because they want to help people and see people getting healthy. And our system gets in the way of that a lot of the time, and sometimes even causes greater burdens than what the person started out with. So within Xena, we will be working on projects together that will reignite your passion and purpose if it's aligned with your values. So Xena also addresses the fragmentation in our healthcare system. So we'll be collaborating not only within healthcare with physicians and nurses and social work, also across sectors, people that are lawyers and patients, people from all areas who have a unique perspective, and we need to hear their voices, and we need to work together so that we can build a better healthcare system together. And ZNA also includes the community's voices. We're going to be learning about how to engage with our communities and how to include them in our decision-making process from the beginning of our projects all the way through to the end. So ZNA is for healthcare providers who are wanting to grow professionally as leaders, who are also healthcare professionals who want to collaborate with others and feel a strong connection to their work. ZNA is also for community members who are advocating for equitable, accessible, and whole person health. This is just some research. The Robert Wood Johnson Foundation showed how important community engagement is. And we know that providing whole person health, looking at the whole person, really promotes health equity and improves outcomes. So ZNA is a network bringing us all together. It's both a learning platform and an action network. So we are kicking off ZNA with bringing in guest speakers who are going to be talking about their programs that are successful in improving the health of their communities. We'll also be bringing in guest speakers who are knowledgeable about how to build relationships with both healthcare providers and patients, and between the healthcare institutions and our communities. We'll be bringing in all kinds of guest speakers and then have different courses and workshops. And we're also going to have things like grant writing workshops and things so that we are more effective when we go into the action side of the network. We are choosing our pilot project currently, and we'll be kicking that off by the end of the year and learning from it so that we can scale our projects outward in the future. So this is kind of what I was just talking about, what we do. And ZNA is, we have a discussion board where we can all discuss what we're passionate about. We all have different niches and different things that we're drawn to, and we have different perspectives. So there's so much that we can learn from each other. And there's also a lot that we can learn from what's already working out there, what solutions are already out there that we can learn from and implement in our projects. And so there is a community access tier that is free for anyone. You can come in and hear what we're talking about, be a part of the conversations, and as well as join our monthly meetings and have access to some of our guest speakers. The Innovator Circle is currently free, and then it will be $150 a year after we have built it out more. But the Innovator Circle is where we are going to be working on the projects together, and you'll have more access to resources and different courses and trainings. So this is what I was just laying out for everyone. This is what will be in the Innovator Circle. And our Innovator Circle also, as we're working on the projects, we're going to post in the community side so you can learn about our progress. We can ask you questions in the community and get support. And if people want to donate from the community towards a certain project, then they could be involved with that. So some of the projects that we may have would be emotional intelligence training or leadership training of healthcare workers. We will have some projects to scale established community-based programs and expand access to mental health resources. And some of the projects may be looking at bringing in integrated multidisciplinary clinics or care teams. So this is just a rough timeline. Initially, we're just now bringing in new members and building engagement, and we'll be launching our first workshops and bringing in some guest speakers here soon. And mid-year to fall, we'll start our pilot project and just start building the groundwork for it. And by the end of the year, we'll take a look back and revise the platform as needed. So some of the support that I'm needing is ideas and insights on funding, as well as partnerships with other networks and people who are change makers in healthcare and outside of healthcare, and then also just help in bringing in new members. I'm going to be starting as a speaker And so if anyone knows, has any connections to get me on stage, I would love that as well. So this is my contact information here with the website www.zenahealthnetwork.com. And you can find me on LinkedIn at Athena Lauren Hall.